What are vaccines? Vaccines are the most effective way to prevent infectious diseases. In this video, we will discuss what vaccines are, how they work, and why they're so important. So what do vaccines do? Vaccines protect you from many serious and potentially deadly diseases. They protect other people in your community by reducing the spread of the disease. They also reduce or even get rid of some diseases if enough people are vaccinated. How do vaccines work? Vaccines teach your immune system how to protect you from diseases that are caused by bugs like bacteria and viruses. When a person gets a vaccine, they're injected with a weakened or dead version of the virus or bacteria. Your body is tricked into thinking it is infected with the actual virus or bacteria. This causes your immune system to respond in the same way it would to a real infection. Within your immune system, you have white blood cells, which you can think of as an army of cells defending you against infection. They make substances called antibodies, which help your body recognize and destroy the bug. Your immune system remembers the bacteria or virus. Therefore, if you're ever exposed to it again in the future, your immune system knows what to do to fight it off before it can make you sick. Essentially, this means you're protected from getting the disease. This is called immunity. Overall, it's much safer for your immune system to fight the dead or weakened bacteria or virus through the vaccination than by catching the live disease, as the live disease can make you very ill. Why are vaccines so important? Vaccines protect against many different diseases. In addition, when a high percentage of a population have been vaccinated against a disease, they can achieve what is known as herd immunity. If enough people are vaccinated, the spread of the disease is reduced, and it can even be eradicated, as was seen with smallpox. How vaccinations reduce the spread of diseases is shown in this story. There are 3 villages, each containing 2 people with a contagious disease. In village A, no one is vaccinated, therefore most people can get the disease, so it spreads through the population. A real-life example of this is the spread of the common cold. In village B, some of the population gets vaccinated. As a result, fewer people can get the disease. However, it still spreads through some of the population. An example of this is shown by the spread of measles, mumps and rubella, as not everyone has the MMR vaccine. Lastly, in village C, most of the population gets vaccinated. Therefore, most people can't get the disease, so it eventually dies out. This was the case for smallpox. Finally, this video will look at some myths around vaccines. Vaccines are not safe. False. They are thoroughly tested for safety and effectiveness. Vaccines cause autism. False. There is no proven link between vaccinations and autism. Vaccines overload or weaken the immune system. False. It's safe to give children several vaccines at a time. This means that children can be protected from more diseases with fewer injections, which can make the experience less distressing for them. You can get the disease from the vaccine. False. This is because you're injected with a weakened or dead version of the bacteria or virus, so it can't make you sick. However, people with some rare conditions or taking treatments to suppress their immune system may be advised not to have certain types of vaccines. If you're not sure, please ask your doctor. Overall, vaccines prevent up to 3 million deaths worldwide every year. Therefore, as more people are vaccinated, we increase the chance of reducing the spread and even eradicating certain diseases.